Having cancer is traumatic.
And it's been difficult. It's been difficult emotionally, physically, and financially.
Well, the goal is to live.
There was quite a bit of fear for both, me, my dad, my other brothers. We weren't quite sure what to expect or what was going to happen.
The drugs that I was put on, like, they only work for so long, and then they don't work anymore, so then we have to do something different.
But there are times when we have to change treatment to a less than ideal regimen to make certain that the patient's insurance needs are met and that we don't devastate them financially.
Currently, the way that insurance companies cover anti-cancer medications, on the medical benefit side for their IV or injectable anti-cancer medications, they're paying a typical office copay. On the oral side, they're being asked to pay a co-insurance of the cost of the drug. They're often being asked to pay upwards of thousands of dollars per month per prescription.
My copay would have been $900 every 3 weeks.
$9,000 a month, 25% of that would almost take all of my paycheck.
Many cancer patients don't have a choice between an oral anti-cancer medication or an IV anti-cancer medication. It's not a matter of convenience for them.
We've seen a dramatic increase in targeted therapies and in treatments that are no longer IV chemotherapy. We have drugs that are oral, that target certain genes and are game changers in certain cancers.
If this oral parity bill doesn't pass, I would probably have to ask Dr. Meshad to find another treatment for me. Maybe a drug that's not quite as potent or, successful for me.
The legislators should understand that patients with cancer need access to treatment, whether it's IV or oral.
It's hard enough to be diagnosed with cancer. Shouldn't also have to take into consideration the cost of cancer or the cost of your treatment.
So what we would encourage the insurers to do is have a policy that covers cancer drugs, period.
We have savings, but at that price, at the copay price, it won't last very long.
People work really hard to pay their insurance premiums on the promise that their treatment is going to be covered. And then they receive a diagnosis and a treatment that they can't afford because of the way it's administered. Really, then they have to make life or death decisions.
Because that's what happens with terminal illness. You die. And you die faster if you can't get access to drugs.
Please consider, what it would be like for your family member. What would you want to happen if it were your family member going through this?
Because it's somebody else's life, it's easy to look the other way, but you shouldn't.